problem with polycystic ovaries. If you, the step number 1 in the treatment of polycystic ovaries, many of them will be very obese and they have lots of hair growth, acne and all that. So the most important thing is decreasing the weight. If you decrease even 5% of the total body weight, then you get a good reduction, or 10% you get a 5% improvement in fertility rate. So that is very important. So weight reduction and weight reduction is very, very important in treating polycystic ovaries, because the more the fat in the body, all the hormones concentrate on the fat, not on the ovary. So reducing the weight really helps. There are medications to reduce polycystic ovaries like metformin and myoinositol. So we use these medicines also to make the egg quality better and the egg release better. But most important is you give tablets, you give injections, you do a scan, a follicular study which helps you to monitor the growth of the eggs, and when the eggs reach the right size, like around 20 millimeters, you give the injection to release the egg. Generally, egg is released about 36 to 40 hours later, and this is the time when you should tell the patient to have intercourse, because this is the best time when the pregnancy will happen. So this follicular study is very important, and sometimes even after 2-3 cycles the patient fails to get pregnant. So then you do what we call an intrauterine insemination, which means that you prepare the sperm, you select the best sperms, and then you put it inside the uterus. Instead of having intercourse when the egg is released 36 to 40 hours, you prepare the sperm and you put it inside the uterus. Now why do we do this? Because sometimes there are antibodies in the mouth of the uterus which don't allow sperm to go in. So however good the sperm count is. So if you prepare the sperm, then you're selecting the best sperms. You are bypassing, because you're putting it inside the uterus, you're bypassing the antibodies, and you are putting the egg and the sperm close to one another. So all these help to improve the pregnancy rate to 20% better than with natural intercourse. So this process is called intrauterine insemination. So how many times you can try intrauterine insemination? At least 6 times you can try, and if everything is very good. But if there are small problems, the other issues like low sperm count and the fallopian tubes are not that good, then in that case you cut down the number of attempts and you now have to go on to IVF. So in IVF, like I said earlier, you collect the eggs, you inject the sperm into the egg, form the baby, and then put the baby back into the uterus. So ultimate treatment for polycystic ovaries is doing an IVF, but we try all the other modalities before we make that final decision.
Ma'am, one more question is coming to my mind, is how does fibroid affects to infertility?
Yeah, that's a very important question, because 15% of population have fibroids today. It could be 1, 2, it could be 20, 25, it can even be 93. So we have handled the fibroids of any number. So patients have a misconception that if you have too many fibroids, the doctors will advise a hysterectomy. No, never. Even if you have 90 fibroids, we have done it. We have removed all the fibroids and the patient has become pregnant, and they have had 2 babies after the fibroid surgery. So even if you have many fibroids, you don't have to worry. What is very important is you should do something called a fibroid mapping, which we do in an ultrasound, which will tell you the exact number of fibroids, the location of the fibroids, and its closeness to the endometrial cavity, which is the place where the baby grows, and how much it is disturbing that area. So once we know this, then we make a plan. Then when we remove the fibroids, the number of fibroids that you have recorded should come out during surgery. If it does not come out during surgery, then we use the ultrasound in the theatre itself. We check whether we have removed all the fibroids, and then if we haven't, then we actually look at the location of the fibroid on the intraoperative ultrasound. Then we take out the fibroids. Now the most important thing is, how do you reconstruct the uterus after removing the fibroids? Now we have a 3D laparoscopy, and we actually look at the fibroids through the 3D laparoscope. And the 3D laparoscope, I tell you, is a wonderful piece. It's like looking at a 3D camera or a 3D movie. You can see every blood vessel very clearly. You can see all the muscles very clearly, and you can catch the blood vessels early and minimize blood loss during surgery. Then once the fibroids are taken out, then we have to remove them outside. So how do we do it? Through a small 10 millimeter incision or a 10 millimeter cut. just a 1 centimeter cut, okay.